Good evening, doctors. Welcome again. Today we are going to discuss about acute liver failure. Okay, acute liver failure describes the rapid onset of hepatocellular function leading to variety of symptoms and complication. Okay, so what you have to remember here, this is a rapid onset of hepatocellular dysfunction, leading to variety of symptoms and complications. Okay, now, okay, sorry guys. So the causes of acute liver failure is viral hepatitis, paracetamol overdose, alcohol, acute fatty liver of pregnancy. Others includes Wilson's disease, following shock, etc. So remember, the cause of acute liver failure is viral hepatitis, paracetamol overdose, alcohol, acute fatty liver of pregnancy, Wilson disease, and shock, etc. Okay. Now, what are the features when the liver is not able to function properly? Features include hepatic encephalopathy or cerebral edema, coagulopathy raised PT, prothrombin time elevated, jaundice we see, hypoalbuminemia, renal failure due to hepatorenal syndrome, high plasma aminotransferase after paracetamol overdose. Okay, and how to manage acute liver failure, that is transfer to a high dependency or intensive care unit, HDU, or we can say ICU, transfer the patient. N-acetylcysteine therapy for acute liver failure due to paracetamol poisoning. N-acetylcysteine is a antidote of paracetamol poisoning, or paracetamol is acetaminophen. Okay, liver transplantation advised if adverse prognosis. So guys, this is all about acute liver failure. If you have any queries, any question regarding this, you can ask me, and if you're new on my channel, please subscribe it. Thank you, good day, goodbye. That's all for today.